Hi, we're here for chapter 2 in the MDA book today. So, chapter 2 is the dental health care team. A team is people working together for a common purpose. So, you're going to be working in a team in your dental office. The team can be made up of all different people. So, a dental office is a place that it doesn't have a standardized set of people working in it. You can be in a large office that has several doctors and several auxiliary members, or you can be in a small office that has a single doctor with a few auxiliary members. So each office is set up differently in the way that people are assigned duties. So in dentistry, the purpose or mission of the team is to provide quality oral health care for the people of the community. So that is your main mission working in the dental office. When you are working in the office, the dentist is the one legally responsible for the care of the patient and the supervision of all of the members of the team. So even though the dentist is the one that's legally responsible for the care of the patient, it doesn't mean that you are not responsible for what you do in the dental office. You can be held legally responsible for the things that you do in the dental office, as well as morally and ethically responsible for the care that you provide. The doctor is also, like they said, responsible for the supervision of everyone in the dental office. And that is whether the doctor is present in the office or not. When we go to the members of the dental healthcare team, the dentist is the general or specialist that is the provider for the dental treatment. Dental assistant, which will be you, can be a clinical assistant in working side by side with the dentist, completing the treatment on the patients. You can be expanded functions, where you do additional duties. Expanded functions can be placing fluoride, it can be removing sutures, it can be even placing fillings depending on your certification. And then there's the business assistant, which they can be called a business assistant, they can be called a receptionist, they can be called front desk, they can be called administrative assistant, a scheduler. It just depends on how many positions are available and what their duties are. The dental hygienist or registered dental hygienist is the one who is in charge of preventative duties for the patient. So preventative duties include removing deposits off of the teeth, placing sealants and fluoride applications. The dental laboratory technician is the one who fabricates the crowns and bridges, implants, dentures, partials, things like that. And they're making these appliances that go into the patient's mouth as either removable or fixed appliances. So here, the dentist, the licensed practitioner qualified in the prevention, diagnosis, and treatment of diseases, injuries, and malformation of the teeth, jaws, and mouth. So here in the US, they graduate from CODA approved dental school. So they successfully passed the National Board Dental Examination and a clinical board exam for license in the state of the practice. So they have to pass a written and a clinical or didactic examination. So hands-on and written for a dentist. These are the dental specialties that they can join. So dental anesthesiology, dental public health, endodontics, oral and maxillofacial pathology, oral and maxillofacial radiology, oral and maxillofacial surgery, oral medicine, oral facial pain, orthodontics, pediatric dentistry, periodontics, and prosthodontics. So I said 9, there are now 12 that are specialties that are recognized by the ADA. So I did misspeak, and I do apologize about that. So with the 12 specialties recognized by the ADA now that they have added to this list, You can see that the list is constantly growing because healthcare is constantly changing. And that is the one thing that remains the same in healthcare, is that it's constantly changing. So we're always adding new treatments, new specialists to our broad horizon that we have in healthcare, whether it is a doctor or a dentist, so that our patients can have the best quality treatment possible. With dental practice settings, so there's different types of offices. Like I said earlier, we can have a dentist owned and operated group practice where the dentists own and decide what happens in the practice. Or we can have a dental management organization affiliated group practice. So this is where the dentists manage and own the practice. It's a group practice, but they have several different offices. So the owners aren't necessarily working in the office. An insurer provider group practice is another type of practice that you can look into in your book. A government agency group practice where they are only providing government benefits at this practice, like if they were to be like a VA hospital. And non-for-profit group practice, where this is all nonprofit in this practice. So for a dental assistant, so the duties assigned to the dental assistant are determined by the regulations of the Dental Practice Act of the state in which he or she practices. So they can change from state to state, and you need to know that, because when you are working in Ohio or Michigan or whatever state that you're working in, and you move, you need to know what the new regulations are in the Dental Practice Act of the state that you live in. Or let's say that you live in Ohio, but you live close to Pennsylvania, and it's only a 20-minute drive to Pennsylvania, and you work in Pennsylvania, but you live in Ohio. If you live in Ohio, but work in Pennsylvania, you have to follow Pennsylvania's Dental Practice Act when you are working in Pennsylvania. If you work in Pennsylvania 2 days a week and Ohio 2 days a week, then you have to follow the Pennsylvania Dental Practice Act when you're working there 2 days a week, and the Ohio Practice Act when you're working in Ohio 2 days a week. You have to follow the rules of the state that you're in when you're there. It's very important not to work outside of your scope of practice, or not to do anything that you haven't learned, been taught, or that you're allowed to do according to the State Dental Practice Act. You can be penalized for that in way of being brought to court. So, you can be sued for that. It can be criminal action. You could have license revocation, additional CEs assigned to you. There are lots of different things that can happen if you are doing things that you should not be. So it's always best practice just to do what is allowed by your State Dental Practice Act. If a doctor or someone else in the office asks you to do a duty that is not assigned to you in the State Dental Practice Act, and you know that it is outside of your scope of practice, or you look it up and it's outside of your scope of practice, you need to be sure to tell them in the most professional way and not in front of a patient that that is not one of your duties and you do not feel comfortable doing that duty. They may not be aware that that is not in your scope of practice. So it's best to be upfront and let them know, hey, this is not in my skill set, and it's not in the Dental Practice, it's in the Dental Practice Act that I'm not allowed to do this. So please assign this duty to someone who is skilled to do this. So it's going to save you a lot of grief, and it's going to save you a lot of headaches down the road. So you're trained to perform many activities that are not required of the dentist. You can do a lot of things, but do not do things that you are not trained to do. So for employment opportunities, you can work in a private dental office. You can work in a specialty dental office. a health clinic, or a school system. There are research facilities out there that you can work in, the public health departments. You can work with educational programs, insurance companies. You can even teach after you have been out of school for at least 2 to 3 years, depending on the school. Here at Ross, it's 3 years to be a teacher. And if you've had 3 solid years of work experience and have your national certification. So that's also something to think about. So here are some of the roles and responsibilities of the dental assistant. So you know that you're going to be out there preparing the patient for clinical care. You have to not only get the room ready, but talk to your patient and make sure they're mentally prepared for their care, that they understand what is happening and why it's happening. Collect and record medical and dental history from your patient. Make sure that you have the most up-to-date information on your patient and that it's documented in the chart. You will be assisting the dentist in managing emergencies, whether they're emergencies that are scheduled in the schedule or an emergency that pops up in the office. And you need to be prepared for that. All offices should be training for emergencies at least once a month. Provide patient information in oral health care. So you're going to be going over going home instructions, at home care after procedures, before procedure care, instructions to your patients, like if they have to take a pre-med, things like that. So you're going to want to be fluent in that. You're going to assist your dentist in lots of different procedures. So make sure you're paying attention when they're training you as to what instruments they have out, where they have things stored, so that you can go and get these things and set these trays up when you are asked to do that. You can perform expanded functions as allowed by your State Dental Practice Act and provide post-operative instructions. You're also going to be managing infection control, which is very important, making sure that everything is clean and set up for each patient. You want to think of it, how I thought of it was, if one of my family members was to walk into this office right now, would I feel comfortable seating them in this room? Is it clean enough for them? Is it clean enough for me? You want to make sure that your patients are being taken care of like they're one of your own family members. For the roles and responsibilities of the dental assistant, this is a list of roles that you may take on as a dental assistant in the office. So taking x-rays, lab procedures, you may be doing impressions, you might be pouring up study models or making appliances in the lab. Providing assurance and support for patients is definitely something you'll be doing. You need to be compassionate and empathetic to your patients. Greeting patients as they come in the office. It's important that patients are acknowledged as soon as they come into the office. They shouldn't just come in and sit in the waiting room or the reception area and wait for someone to come out, the assistant that it has them on their schedule. They should be greeted as soon as they come into the office. You may be answering phones, scheduling and confirming patients. Patients need to be confirmed 24 to 48 hours before their appointments. So depending on the size and the dynamics of your office, as an assistant, you may be scheduling and confirming appointments as well. Managing patient records, payroll, or billing could be a part of your responsibility depending on the dynamic of your office. Ensuring patient privacy and making sure that you are taking HIPAA seriously and enforcing that in every action that you take, and overseeing patient relations. The registered dental hygienist is a licensed professional who's focused on the prevention and treatment of oral diseases. So like I said, they're prevention. So the minimal education requirement for a hygienist is 2 years of college study in an ADA accredited dental hygiene program. So with hygiene programs, they are 2 years long, but then there's usually 2 years of prerequisites. So hygiene for an associate in hygiene, it usually takes about 4 years. A dental hygienist is also offered in bachelor's and master's programs. The RDH is required to work under the supervision of a licensed dentist. So they can't go out and just open their own clinics, but they can work under the supervision of a dentist. And after they've worked so many hours, they can also take an additional class and work under the supervision of the dentist, but like they can work with the dentist out of the office and still do cleanings on patients. But for limited amounts of time, I think up to 2 weeks at a time by themselves. So with their roles and responsibilities, that is to perform oral health care assessments, including in reviewing patient histories, because we're always going to review our patient history. They're educating their patients on proper oral hygiene techniques, and they will perform a dental prophylaxis, which is a cleaning. During that prophylaxis, they remove plaque and calculus from above and below the gum line. They apply cavity preventative agents, which are fluoride, and those sealants on the molars. They will take radiographs and assess periodontal status, meaning they will look and evaluate if the patient has gingivitis or periodontal disease. And they will perform additional procedures as allowed by law. Rarely in the dental office is a laboratory technician. They usually work in a private laboratory, and they perform tasks written by the doctor on a prescription. They communicate and collaborate with the dentist to perform dental prosthetics. So their training is either a 2-year accredited ADA program, an apprenticeship, or a commercial school. A certified dental technician or CDT must pass a written exam. And their roles are to work with a variety of materials, fabricate full and partial dentures, fix bridges, implants, veneers, crowns, and orthodontic appliances.